Hello!
Hi!
Yay! Thank you so much for
Yay!
joining me tonight.
Thank
I
you
I
for
saw your
inviting
name,
me.
looking amazing. Thank you so
Oh,
much for. I feel like we're having a wave night tonight. I think we're having waves tonight,
yes, the
right?
wave. I was like, I have to look a little bit cute for this
No, no,
Instagram live, so
no,
I'm like,
no,
let me just like do a little curl thing.
no. My hair is actually usually like straight flat. For some reason, it's wavy tonight. I think it's to match your energy tonight. See, it's meant to
Yes,
be.
we just like
Anyway,
knew
we
somehow.
just knew. We just knew. Well, we're like what 2,500 miles away. I know you're all the way in the West Coast.
I
I was just
know.
there. I was just there last month actually. I was visiting my family there, and
Oh,
I'm here in the East Coast, here in New York. But still, we got connected
that's
a
so
few
funny.
months
I was
ago.
there 3 weeks ago.
Oh, really?
I was in
I
New
was
York.
there. I was there around 3 or 4 weeks ago too.
That we missed each other.
I know. Well, I'll be back soon, and maybe you can visit New York again.
Yes, yes,
But
definitely.
anyways, again, thank you so much for giving us the time tonight with your presence and your knowledge. Just first introduce yourself to everyone.
Yes, thank you so much. Hi, everyone. I'm Veronica. I am a physical therapist. I have a Doctor of Physical Therapy degree. I've been a physical therapist, wow, for like 2 years now, which is kind of crazy. I still feel like a baby PT. But yeah, I've mainly, so straight out of PT school, I spent half of my career in the hospital setting. So I was an acute care physical therapist. I was like in the med surge telefloors, ICU, emergency department. Sometimes I'd be sent to the postpartum and labor and delivery floors. That was fun for that first part of my career. And then COVID hit and it was like really crazy for a while. I'm
I
sure
can
you know.
imagine.
I mean,
Oh
you
my
know, you're
gosh,
in
I
New
can
York.
imagine.
And then recently I've transitioned into something called home health physical therapy. So that's what I'm doing now for the most part. I'm providing physical therapy in the comfort of my patient's home. And then also on the side, I just recently, like last week, started a teaching position. I'm a it's like a small position, it's a lab assistant job back at my alma mater where I graduated from
Mhm.
PT school. But I'm really excited because I do want to go into teaching one day. So
Yay.
I think this is like a step in the door. Yeah, so that's me.
Yay, thank you. Physical therapy. So, when I started promoting our live, I actually got a lot of questions. I feel like we've known physical therapy for a while, but I think there's also different types of therapy and also within like the whole physical and physio field. I have
Mhm.
questions that we will tackle later, like what's the
Yeah,
difference between a PT and an OT and a rehab medicine and
sure.
chiro and this and that.
Yeah,
But
yeah.
can you take us back to the journey it takes to get to where you are now? I know you are doctorate trained and DPT. Is that the same for the rest of the countries in the world? Does everyone
Um,
go straight into a DPT program, or because I know PTs here who came like from Asian countries, but specifically the Philippines, and I know they graduated with a bachelor's degree there,
yeah,
and
I
then
was
now
gonna
they're taking
say.
DPT here. Yeah.
Yeah, so I was gonna say I do have coworkers that still have their bachelors and they are from the
Mm-hmm.
Philippines back in the hospital. So they, I mean, they're licensed. They just had to take the licensing exam
Mm-hmm.
here. But yeah, if you do go to school here in the US, now across the board, it's basically DPT programs. It was at one point a master's, and then in the last, I
Mm-hmm.
believe, 10 years or so, just in the 2000s,
Mm-hmm.
it's changed to DPT program. But that's a good question. I think around the world it is a little different.
Mm-hmm.
I think it may be like bachelor's degrees. Specifically, the Philippines
Mm-hmm.
is the one I
Mm-hmm.
know. But yeah, I don't know like other countries.
Yeah, yeah. How about here though? I know it's straight to DPT now, but do you graduate? Because I have friends who apply to DPT programs. I know it's undergrad first, right? And
Yeah.
then you apply for the DPT program. Is that correct?
Yeah, so you are required to have a bachelor's degree. It can be any degree. You just have to have a set amount of prerequisite
Mm,
courses. And
mm,
so that's typically a bio series, a chemistry
mm-hmm.
series, a physics series, and then a psychology
Got it.
series. And yeah, so I got my bachelor's in kinesiology just because
Mm-hmm.
that particular major had all the prerequisites
Mm-hmm.
inside of the
Mm-hmm.
major, but you don't necessarily have to have a kinesiology or an
Mm-hmm.
exercise science major. Just make sure you have some kind of bachelor's degree
Mm-hmm.
and make sure that you get the prerequisite courses.
Got it. And applying to the DPT programs, you'll obviously, is there a standardized exam with that, like the GRE or whatnot?
Yeah, you have to
Mm,
research certain DPT cohorts. Some of them
mm-hmm,
do want the
mm,
GRE, but like when I applied to my particular school, they didn't require it, but I think they do
mm.
now. So,
Got it.
yeah, sometimes they do require the GRE.
Got it. And how was DPT school like? What? It's 2 years or 3 years?
3 years. 3 years.
3 years. And can you take us through how each year looked like?
Oh yeah, so it was probably the hardest
I
set
can
of
imagine.
schooling that I
Yeah.
will ever go through because the transition from undergrad to a
Mm-hmm,
graduate program is just
mm-hmm,
so different.
mm-hmm,
So my first year was definitely a big transition point
mm-hmm,
where I had to really like they bombard you with a ton of information. I remember we had an anatomy series where we had to know really every single
everything.
muscle as well as identify it both in pictures and in
Mm-hmm,
cadavers. We did have cadaver
mm-hmm,
lab. So there's anatomy. First year we took physiology course. We started getting to know patient care. So that's like
mm-hmm,
hospital skills
mm-hmm,
that we needed to know. And yeah, and I think we had our first little clinical rotation. It was a small,
mm-hmm,
like 2 week rotation
mm-hmm,
where we just like got to observe. But yeah, that was like my first year. And then
mm-hmm,
second year, it really amps up where you start to learn neuro, you start to learn orthopedics, pediatrics, women's health. So a lot
mm-hmm,
more specialized once you get
mm-hmm,
into your second year. And
mm-hmm.
then your final year, you're not really in school, you're out in your clinical
Yeah.
rotations for the most
Mm-hmm.
part, where you have to get your hands on training. And
Got
yeah,
it.
those are like 3 years of like hard
Yeah.
work.
Oh my gosh, I can't imagine how busy those 3 years are because it's like to condense, right? Like the whole human body and
Yeah.
the whole like physio aspect of it. And obviously you have to know like pharmacology too for sure, right? Like
Yeah, we have one
um
little
path
class.
yeah, like certain patho as well to know all of these. Wow. And then you have the clinical aspect as well. I can't imagine how busy and grueling those have been. But here you are with the DPT after your name. Yay!
Yay!
And where did this stem from? Did you always want to become like, have you always wanted to be, oh, I'm gonna be a PT one day?
Actually, no, I didn't find out about PT until like college,
Oh,
actually.
wow.
So, yeah, I kind of jumped around, which I really encourage a lot of
Mm-hmm.
folks to do because
Mm-hmm.
you never know what you love. Like going
Mm-hmm.
out of high school, because I have Asian parents, they've wanted me to become a physician,
Mm-hmm. Mm-hmm.
like the thing, and I was like, all
We
right, I
know
guess
it. We
that's what I
know it.
want to
Yeah.
do. But after like a little bit of soul searching and reflecting, I realized like I should really want a career that aligns with me
Mm-hmm.
personally and my
Mm-hmm.
values and
Mm-hmm.
how I want to see
Mm-hmm.
30-40 years of
Yeah.
working in the field. So
Yeah.
I thought I wanted to go into psychology. I thought I was going to go into poli sci. At
Wow.
one point I went into athletic training, and
Mm-hmm.
then finally I was introduced into physical therapy and I was like, what is this?
What is that?
Yeah, and then after, doing some shadowing hours, which is required when you're applying to PT school, that's when it really solidified for me that I think I can see myself doing this for 30-40 years. Yeah, so that's how I ended up being it. To answer your question, no, I definitely didn't think I would
Then
be here, and that's okay.
and that's okay. And see, and you love it, right?
Yeah.
And I think that's the best part is as long as you enjoy what you love and you find purpose in it, like you are now. And then this is a question I also ask like all of my guests too, is every schooling, especially like I feel like in the health professions, right? It's so long. You have undergrad, then you have the whole post grad things for you doctorate with 3 years and the didactics and clinicals and all of those things. Was there any regret in pursuing this path or no?
No, no regrets. Like, honestly, what's great about PT is that, like, I mean, even in my short 2 years, I've been able
Mm-hmm.
to jump
Mm-hmm.
around in different settings. So that's what's
Yeah.
cool about PT. If
Mm-hmm.
you're like ever getting bored for some
Mm-hmm.
reason in one
Mm-hmm.
different setting, you can
Mm-hmm.
jump around to
Yeah.
another and you will
Yeah.
have the skills. So I went from the hospital to like home health,
Home
and I'm
health.
doing a
Yeah.
little bit of teaching, and you can do that.
Yeah.
And so I'm happy to have kind of that flexibility if ever for some reason, I just want to do
Mm-hmm.
something else. So yeah, no regrets. I find it very fulfilling, and I love being able to help patients move, being able to
Mm-hmm.
help them walk, and like,
Mm-hmm.
family members. I feel like I'm
Mm-hmm.
not just helping the patient, but I feel like I'm
Yeah.
helping the family unit in
Yeah.
general, and that's what
Yeah.
really means a lot to me.
Yeah. Yeah. And that's something I really want to touch upon is first one is I feel like a lot of people don't know how extensive and specialized physical therapy could be, right?
Right.
Like
Yeah.
I work in the hospital for like cardiac surgery, like
Yeah.
recovery unit,
Yeah.
which is flooded with PTs,
Yeah.
obviously, like trying to get everyone back up after being in the bed for how many days. But then
Yeah.
when I float to the ICU, there's also PTs there. And then if I go to like a postpartum floor, there's a PT there. If I go to this floor, there's a PT, like in the neuro floor, like
Yeah.
PTs are everywhere because it's not just, I think this is a big misconception too. And you could correct me if I'm mistaken, but it's really more than just the musculoskeletal. It's like literally the whole body. And I think a big part of it that we'll talk about is like the psychosocial. Like
Oh,
the
totally.
amount of restorative work that you do for the patients and for their families, it's like it blows my mind. It's literally making someone walk again, right?
Yeah.
And can you talk more about that? Like when you go to work, how does it feel entering work and also leaving work knowing that, wow, I am helping this person regain their life again, right?
Right. I mean, that's like an awesome question because I'm so glad you like see the benefits of
Mm-hmm.
PT because like yeah, it's so much more than movement because
Mm-hmm.
if you think of your everyday life, we're
Mm-hmm.
literally moving
Mm-hmm.
every day. Like
Mm-hmm.
literally from me just using my hands to
Mm-hmm.
communicate
Mm-hmm.
to you,
Mm-hmm.
to walking to my car, to
Mhm,
just walking
mhm,
to the bathroom. And like
mhm,
these are things that we all, I think, take for granted. And then for
yeah,
patients, it like talking to your psychosocial part,
mhm, mhm,
that really is like so saddening, and like losing your independence is
mhm,
really like a heartbreaking thing.
mhm,
So yeah, there's like a lot of, even though I'm a physical therapist, sometimes I
mhm,
feel like I'm a therapist, like trying
yeah,
to get
yeah,
to the root of like what's going on, like
mhm,
why don't you feel like you can do it, and just really getting to the root of their psyche. And a lot of times it's just, trying to motivate them, trying to see what their goals are, and really connecting your treatments to the
mhm,
patient's goals. But yeah, to answer your question, yeah, there's so much more, and
mhm,
like we never realize how much we're losing once we lose, our strength or our
yeah,
balance or our ability, to
yeah,
just move around in the world.
yeah,
Like
yeah,
that's a lot of independence that is lost. So I'm
yeah,
just so grateful that my job is giving them some ability
yeah,
to get that back fully, or if
yeah,
not, maybe I'll get you a walker, or maybe I'll
mhm,
get you a
mhm,
wheelchair. And like it
mhm,
might not be exactly how you were
mhm,
moving before, but
yeah,
I'm still gonna get you to move somehow.
yeah,
Yeah,
definitely.
super fulfilling.
Yeah, and I love your point about the whole we take it for granted. So, and for those watching who don't know, there is a term, at least in my hospital, we call ADLs, right? Activities of daily living.
Yeah.
And if you think about it, it is daily living. Like when we pick up the utensils to eat, when we open the doorknob or we
Yes.
turn on the faucet, right?
Right.
These are things that are so ingrained now. It's like muscle memory that we don't even think about it anymore. But
Yeah.
when someone gets an injury, right, or has a major surgery, or has a stroke, and has all of this post-op complications, like
Mhm.
those daily living things are gone, and
Yeah.
that's where the power of physical therapists come in, right? It's trying to reclaim that again, and it's
Mhm.
I can imagine just how of a journey that is for every patient, right? Especially at home health too. It's like the most intimate place ever, right?
Yes. And that's why I love home health, just because it
Mm-hmm.
is very intimate and like sometimes sessions involve the family, which is really important to me. Like I want to involve as
Mm-hmm.
many folks as
Mm-hmm.
possible
Mm-hmm.
because once I step out of the home, I'm
Mm-hmm.
hoping that the family members are able to do what I do and like
Yeah.
motivate them, or
Yeah.
I'm just hoping that it continues because like literally I'm in the
Mm-hmm.
home for like 30-40 minutes at a
Mm-hmm.
time. Like
Mm-hmm.
that's a short amount of time
Mm-hmm.
for me to empower the family and
Yeah.
empower the patients to do their exercises, to make sure that they're safe and using their walkers or crutches,
Mm-hmm.
canes, what have
Mm-hmm.
you. But yeah, I love the intimacy of home.
Yeah. Yeah, that's why I always say too, like to everyone, like us healthcare workers, our patient is not just the patient with a diagnosis. It's the
Mhm.
whole family, right? And
Yeah.
sometimes that's the harder aspect of the care. It's the family themselves. And I know someone who's like a pediatrics PT, and I feel like a lot of that rests also on the parents, right? Or those at home to, like you said, like to empower the family to continue the things that you are doing once you leave the home. But that being said, though, do you think that there's a bread and butter, specifically in home health? Like, is there a day or there's days where it's like, oh, I know for sure this is the type of patient I have, like whether the cause of injury or the diagnosis why they need you. Is there like a pattern of, oh, this is like the most common reasons why you're seeing someone?
Yeah, I mean, I see like really a whole range,
Mm,
ranging from like maybe they had a total knee replacement or a hip
mm,
replacement. For
mm-hmm,
sure, I'll be seeing that's kind of like a big bread and butter
mm,
PTs as well.
mm-hmm,
But
mm-hmm,
lately, I've been seeing a lot of patients that have been discharged post COVID as well. And so they need to,
mm.
yeah, like needing to help with
Interesting.
endurance because their
Mhm, mhm.
lung capacity is
Got it,
really
got it.
affected. So even though we have our bread and butter like area, which is usually strength, weakness, maybe they had a fall. So that's like
Mhm, mhm,
that's
mhm, mhm,
typically when the doctors order some PT. But yeah,
mhm,
lately I've really been seeing like a lot of post COVID, just really endurance that is super
mhm,
affected. Maybe they're not even able to leave
mhm,
the home anymore, and just like a big loss of independence. So
mhm,
yeah, I'm seeing all the common things, but I'm also seeing
mhm.
like a lot of new things because of the pandemic.
See, I'm telling you, this whole pandemic, like, literally shook the world, right? It's
Yeah.
like we're seeing things that we've never seen before.
Oh, yeah.
And like when I was seeing like long COVID, I was like, long COVID, what's this? And then people like can't get up anymore. People like it's so hard for them to breathe even like months later. And it's literally like mind blowing as to the effects of this whole pandemic. And how has the pandemic like changed your work aside from these new cases?
Definitely, it's made it harder. I mean, when I was working in the
Mhm.
hospital, that was like very
Mm.
difficult when it really hit the peak here in SoCal. It was like, I remember when I was working at my hospital, we were at like 300% capacity. It was like insane. Like, patients were lined up in hallways. We converted our gift shop into patient rooms because we
Yeah.
were just running out of space, but we still needed to keep admitting patients. So I really saw the importance of PT because of
Mhm.
the need of just we really needed to
Mm.
discharge patients, right?
Yeah.
So like we needed to get a patient a walker so that they can go
Mhm.
home safely, so
Mhm.
that they didn't need
Mhm.
to stay in the
Mhm.
hospital setting.
Mhm.
We really needed to be on our game with that, especially going to the ICU when patients
Mhm.
were still on the ventilator or on
Mhm.
high flow nasal cannula. We were
Mhm.
the ones needing to stand them up and keep their strength up.
Mhm.
So, like within the whole range of patients in
Mhm.
COVID, we still saw a lot of COVID patients and saw
Mhm.
the need for
Mhm.
physical therapy, like no matter
Mhm.
what. I've seen
Yeah.
COVID patients in every stage.
Yeah. Yeah. For sure. And when it comes to equipments, how do you deliberate like, oh, this is the equipment you're gonna get, and is there always expiration date to equipment? It's like part of the plan, or some people are just meant to be an equipment forever?
It definitely depends on the
Mm-hmm.
patient. Like
Mm-hmm.
obviously if like for the time being the patient is really weak right now and they're not
Mm-hmm.
able to walk with good stability and no loss of balance, then
Mm-hmm.
already in my mind I'm trying to decide if they need maybe they
Mm-hmm.
would need a walker or maybe
Mm-hmm.
they would need crutches, and definitely like I'm trying to see what's most beneficial. Like if they had a stroke and are affected
Mm-hmm.
on one
Mm-hmm.
side, they obviously
Mm-hmm.
can't use
Yeah.
one whole side of their body. So
Mm-hmm.
now I'm thinking of like a hemi
Mm-hmm.
walker so that, they can mainly use one side. So, like
Mm-hmm.
a lot of the diagnosis and their strength really dictates the kind of equipment that I'm prescribing. And to answer
Mm-hmm.
your question, if it expires, that's largely based on the patient. Like sometimes
Yeah.
if they follow their home exercise program and they get
Really
better, and
well, yeah.
yeah, if their balance gets
Yeah.
better, if
Mm-hmm.
their strength gets better, sometimes I come to my patients and I'm like, I don't think you need the
Surprise.
walker anymore. I think you
Got
can
it.
actually go without it. So it super depends on the patient and how consistent they are with
Mm-hmm.
like their home exercise.
Yeah, yeah, for sure. And I think a big part of PT as well, from what you're saying, is patient education, right?
Yes.
Whether like in the hospital, you teach them what to do, or you demonstrate before they go home, or
Mhm.
obviously in the home health, you do with them. What do you think are the factors that affect how effective a patient like takes in these teachings and exercises?
Gotcha. I think it's like twofold. One,
Mm-hmm.
a lot of it is me making sure that I am accountable to myself and I'm
Mm-hmm.
making sure that I'm adapting the way I
Mm-hmm.
teach to the way
Mm-hmm.
the patient is able to learn. So, like,
Mm-hmm.
if they are a Spanish speaking patient, am I making sure that I'm getting printed
Mm-hmm.
exercises in Spanish? Or
Mm-hmm.
if the patient is more of a visual learner, am I
Mm,
showing and demonstrating the
mhm,
exercises first? So, on the one hand, I'm really making sure that I know that I'm teaching the way that my patient can best learn.
mhm,
So, that's like
mhm.
one aspect. And
Yeah,
then the second aspect is definitely making sure, that the patient understands what I'm trying to teach them. Trying
yeah,
to get family involved is
yeah,
really big for me because like
yeah,
I kind of see them as me
yeah.
when I leave the
When
home.
you leave the home, yeah.
Yeah, so I really like want to teach as many people as possible
Yeah,
other than the patient. So I
yeah.
think it's twofold, making sure that I'm making it the best for my patient and making sure
Mhm.
that I'm a good teacher will make them, yeah, I think those are the two factors that'll help my patients keep up with their exercises.
Yeah, for sure. Because I mean, I feel like this encompasses every healthcare professional is who deals like directly with patients. There's a lot that comes into play when it comes to a patient's story, right? Like it's literally not just the patient
So,
themselves. It's the socioeconomic status, right? It's the demographics. How's their access to healthcare?
yeah.
What is their geography, right? What's around them? What's not around them? We talked a lot about the family support, psychosocial aspect. Like there's people who don't like asking for help
Yeah. Yeah.
or right? And do you have those patients also who doubt themselves like during an exercise, like, oh, I cannot do that, I cannot do that. How do you
Oh,
break that barrier and be like, no, 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 you can?
yeah, I get those patients a
Mm-hmm.
lot. A lot of times patients, think that I'm prescribing a really hard exercise
Yeah.
to them, but really that's not the case.
Mm-hmm.
And
Mm-hmm.
really the big thing that I have to do as a physical therapist is show them that they do have the strength and they do have the skills in order to do this particular exercise. So a lot of times I'll show them, hey, you've been able to do your knee extension exercises for like 2 weeks now. I
Mm-hmm.
think you have the strength to stand up now. So just knowing that we're going through a process and
Mm-hmm.
that they're in the right spot. So a
Mm-hmm.
lot of times it's all about cheerleading as well.
Yeah.
Just making sure that, what's the worst that can happen if you just try? Like, if you
Yeah.
fall, I'm here, I'm guarding you. it's fine. So yeah, a lot of it's also cheerleading and making
Yeah.
sure that you're
Yes. Yeah, that's why I love what you said earlier, like physical therapy, like you're literally a therapist, like even
so fine.
outside the physical, right? That is true because I mean, from what I see as well, it's like you have to be the cheerleader for your patients, right?
Yeah.
It's it's like, no, you can do it, you can do it. Or if not, like, let's try this other way. Let's try a smaller step or
Yeah.
whatnot.
Adapting. Yeah.
Yeah, and honestly, I was so excited to go on this live because I've been really wanting to speak to a physical therapist for a while now here in the live stream. Because when I started nursing, like also 2 years ago,
Ah,
and I started my cardiac surgery step down floor, like the crux of post surgery is literally preventing infection
hmm.
and two, making them get up again. And
That's
literally, because the longer they stay in the bed, it's like their lungs are not working as they were prior to the surgery, and no one wants to use their incentive spirometers,
right.
and everyone's just in the bed. They don't feel like they want to get up. Obviously, it's painful, of course,
Right.
post surgery, and even like even outside of cardiac surgery, like neuro patients or postpartum for sure, right?
Yeah, for sure.
But the cheerleading, like really, that's so so important. And we
Yeah.
have the cheerleader, the PTs here. Someone saying therapeutic relationship, including being a cheerleader, is so true. Yeah, definitely. I really
Is
really agree with that. Yeah, cause and also sometimes, obviously, family members sometimes do not know what to say or do not know what to do, right? And that's why physicians like yourself who are like offering themselves as the education fountain, right? And also
yeah.
demonstration as well. With all this talk about PT though, a lot of the questions that were asked of me to ask you is
Uh-huh.
like there's a lot of therapists also, and some people it's like, oh, I have this injury in the leg. Who do I see? Do I see a physical therapist? Do I see a
Mm-hmm.
rehab doctor? Do I
Right.
see an occupational therapist?
Right.
Then there'll be like some who'll be like, "Oh, just go do acupuncture or I see a chiropractor." So we've been talking about what a physical therapist does and the whole academia and the training that goes into it. But in essence, relative to these other professions, what is a physical therapist, and how do you differentiate that?
Yeah, so a physical therapist is a movement specialist that will help patients regain anything to do with their mobility. So anything to do with the body and movement.
Mm-hmm.
I know that's like a super
Mm-hmm.
big range,
Mm-hmm.
but that can go anywhere from, weakness to pain to neurological issues to just range of motion issues.
Mm-hmm.
And yeah, just we encompass a whole range of that. And like,
Mm-hmm.
that's like also a whole different range of fields as well.
Mm-hmm.
For many patients, there's like a lot of overlap. So usually
Mm-hmm.
when patients are very, very weak, of course, they'll see a physical therapist. But if you think about it as well, me as the physical therapist, I'm usually trying to think of what other professions this patient would need. So
Mm-hmm.
if a patient is so weak that they can't even get out of bed, then it's
Mm-hmm.
safe to assume that I should be getting an OT referral,
Mm-hmm.
occupational therapy referral,
Mm-hmm.
because I mean, if they can't even have the strength to get out of bed, I don't think they'll
Mm-hmm.
have the strength to put on pants or
Mm-hmm.
to brush their teeth
Mm-hmm.
or to do anything. So
Mm-hmm.
making sure that I know that that's not my scope. I
Mhm,
need to get my colleagues who are
mhm,
OTs to come
mhm,
and help. So
mhm,
there's like
mhm,
I know there's like a lot of overlap
mhm,
between PTs and OTs, which is great, I
mhm.
think,
Yeah, yeah,
because we like those two professions, we like really, really work together.
yeah.
But to differentiate at least PTs and OTs, we think of like just overall mobility.
Mhm,
Whereas occupational therapists, they're really great at tying things into daily activities
mm,
or what they call like occupations,
mm,
just things that patients do every day. But yeah, so like that
yeah.
would be the big differentiating factor.
Mhm, mhm.
Yeah.
When would a patient need to see, I don't know how connected it is though, to like a physician who's like in pain medicine and rehabilitation? Like, is there usually a referral between you two? Are there
I
two
mean,
referral?
yeah, if definitely I feel like in the outpatient setting, if there's like really pain that's going on, that rehab isn't, we're not being as effective, then it's like
Mm-hmm.
a good time to send the patient back to like a pain specialist
Mm-hmm.
or back to their primary care so that they
Yeah.
can get some kind of referral for that. Because like we're physical therapists in that we work on the musculoskeletal
Mm-hmm.
system, so pain is within our scope.
Mm-hmm.
But definitely if there's something deeper going on,
Yeah.
it's our
Yeah.
job to refer patients back to their primary care so that they can
Yeah.
find the deeper root. And yeah.
For sure. And we've been speaking about pain and injury, and obviously all of these things leads to byproducts of like some people get depressed, right? They feel hopeless, or I remember a patient post surgery who's in physical therapy during that time in the hospital because he couldn't do basic movements and he says,
Yeah.
I feel useless. There's the whole psyche of it, and definitely pain as well, and injury, and how it changes a person's life. How do you separate yourself from that emotionally? Because I feel like that's a big part of the job too, right? Is maintaining composure and being the cheerleader
Yeah.
despite knowing how heartbreaking some cases can be, right?
Yeah. Oh man. I feel like that's definitely something I need to work on
Mm,
because it's hard because like I I wish I can do everything. I wish I
mm-hmm,
can provide everything, but
mm-hmm,
there's all in every profession, there's always
mm-hmm,
a limit to what I can
mm-hmm,
do.
mm-hmm,
I can prescribe as much,
mm-hmm,
exercises as I
mm-hmm,
can.
mm-hmm,
I can try to find the best equipment that I can,
mm-hmm.
but sometimes a patient's diagnosis is just so debilitating, especially like if it's a neuro diagnosis that
Mhm,
as time goes by, it just gets worse, like
mhm.
dementia or something like
Yeah,
that. But it's
yeah.
it's really tough. I had an eval today where I
Mhm,
had to unfortunately tell the family, like, I think we need to discharge this patient from physical therapy because we hit a wall. Like they're not benefiting anymore from our
mhm,
services. And that's like
mhm,
really hard because, we came into this profession to
mhm,
help, but I think in order to help myself and like so that I won't get burnt out, I have
mhm,
to understand that there's only so much I can do, right? Like
mhm,
there's
mhm.
only, I'm only one professional, I'm only one
Yeah.
person in a whole team of
Mhm,
medical professionals, and I
mhm,
will do the best that I can do. And I have to accept that that's okay if
mhm.
we're not going to get the most optimal results because
Yeah,
we're not magicians.
yeah,
We're literally trying to heal people
yeah,
with the
yeah,
knowledge and skills that we have, and sometimes
yeah,
it's not enough, and it's okay to accept that
yeah,
because that's life. And as
yeah.
long as you're doing the best that you can and the family and patient knows that you tried your
Mhm,
best,
mhm.
I think that's okay. So
Yeah,
don't get burnt out, people. It's okay.
yeah. That's a great take on that because I feel like aside from like physical burnout, like from our jobs, like the actual tangible labor of work, the emotional aspect of it, I
Oh,
feel like that's a hard part, especially for sure. We've been working for 2 years now, like in all of this, like I can only imagine the amount of stories that
oh
of
man,
patience that you've had so far, right? Like,
right,
I can't imagine how heartbreaking some of those are, right? Like
right.
specifically for your patient that you said earlier for the eval, you said we've hit a wall, we've done all that we can do. What would be the next step for that patient then?
That next step is typically if we've like kind of hit a wall
Mm-hmm,
and we don't feel like PT is benefiting them anymore, then
mm-hmm,
that would typically be the last visit. And we would mainly, I provide like the maximum amount of education that I can,
mm-hmm,
teaching the family range of motion if the patient can't sit
mm-hmm,
up anymore,
mm-hmm,
just teaching them basic things that they can do
mm-hmm,
every day so that they can at least maintain what the patient is right now instead
mm-hmm,
of the patient declining. And
mm-hmm.
we have to be realistic as providers. Like, we can't continue to have ongoing visits if we're
Yeah,
not seeing results because unfortunately, insurances dictate
yeah,
a lot
yeah,
of
Yeah.
our visits.
Yeah.
So we
Yeah.
have to continue to prove that the patient's progressing. So it's really tough when they're not progressing because I
Yeah.
have to answer to a home health agency and an insurance, which it kind of sucks. It's the crappy part of healthcare.
I know, I know. And
Yeah.
that's why I wanted to ask you as well. How much of your work is paperwork?
Oh God, so much, and I hate
I know,
it.
I know. I can
I
imagine.
mean,
I can
you know
imagine.
too, like
Yeah,
really.
charting and all of those. But I feel like the for some reason I feel like the paperwork as a physical therapist
Mhm.
is like so extensive. So one of my friends is a physical therapist, right? Like after every eval, like it's literally pages of paper for one patient.
Yeah, like you really want to, at least I'm thankful that there are some companies now and some like EMR systems that are getting better and are a
Mhm,
little more streamlined. My home health company right now, I'm so grateful we have this EMR system that
mhm,
I've learned to be very efficient and fast and check off all the
mhm.
things, and you learn your efficiencies so that
Yeah.
you can still do all the tons of paperwork without having it
Mhm,
bombard you every day.
mhm,
So I have like templates that I have so that I can
mhm,
just like quickly jot down the important information. But yeah, if there's anything I learned about like healthcare is how to be efficient with documentation because
mhm.
I hate taking paperwork home. It's the worst.
Oh my
So
gosh,
I've
I
learned
can
how to be,
imagine.
yeah. So
I
big
can
tip,
imagine.
learn how to be efficient with documentation. Like learn how to be fast.
I can imagine, yeah. No, I remember, I think that was like a few years ago, probably like almost 10 years ago, where I would see my friend is a physical therapist, and
Uh-huh.
it's literally like doing paperwork in the car. And I was like,
Wow.
wow, this is literally work from home, right? Work from the car, literally like work
Seriously.
after work. I
Oh my,
know. Oh my gosh. I
I've been
can
there.
imagine.
I,
Yeah, but still, I can see how fulfilling the whole field and the whole work is for you. Like we talked about it, right? Like literally restoring a patient's life again, right? Or
Mhm.
at least the pursuit of that, which is such a powerful thing. What would be your advice to someone, a student per se, who wants to pursue this field of physical therapy, but is finding out the why to do so?
Oh, yeah. So my big tip, if you're interested in this profession, is yeah, like you're saying, like figure out your why. And like
Mm-hmm.
I think it always goes back to like find clinical shadowing hours where you see the actual work being done. Because like to this day, I still remember some of the first patients that I ever interacted with as like a student. So
Mm-hmm.
to me, they are my why. It's like always the patient, find out and talk to them and see how much you are affecting their lives because
Mm-hmm.
that's what really tipped it over the edge for me.
Mm-hmm.
And when I realized like this profession can actually, help someone's pain or help them
Mm-hmm.
like get back to an activity that they thought they would never do again. Something
Mm-hmm.
as small as like I never thought I could babysit my grandchildren again, or I never thought I could
Mm-hmm.
carry my child ever again. Like it's
Mm-hmm.
those small moments that you have to hang on to because the
Mm-hmm.
schooling is long, the work is long, but if you
Yeah.
can hang on to those small like beautiful moments where
Mm-hmm.
patients are thankful to you and grateful to you, that's how
Mm-hmm.
you can just continue pushing forward in like a hard journey.
And I can tell that like you're enjoying home health life, right? Even from like your stories and your posts. Do you see yourself doing home health like long term though, or are there other specialties and fields within physical therapy that you wanna dabble into one
Right.
day?
I mean, I think like what's great about home health is the flexibility. I think
Yeah.
I'll always be doing home health in
Mm-hmm.
some capacity because
Yeah.
I can have a full caseload, or I can just have maybe one or two patients to do after maybe my
Mhm.
full-time job.
Mhm.
But yeah, I think, like I've mentioned before, I really would like to go back into some kind of teaching
Okay. Yeah.
job. That would be really cool to me because, like, back in PT school, yeah, I was like a tutor for like a
Oh,
tutoring
okay,
group,
got it. Yeah.
and I
Mhm.
really love that. And then now, as a lab assistant, I really enjoy, I don't know, I think just teaching and like interacting with students is really fun to me. And
Yeah.
then just I feel like I can mold the PT profession, like, in a way, by affecting students. And in a way, if I affect students, I think I can affect future PTs and
Yeah, for
future
sure.
patients.
Of course. Of
So
course. So,
yeah, for sure
yeah.
teaching.
So we're gonna see Professor Veronica
Oh God,
one day then. We're gonna be Prof Veronica,
let's
right?
hope.
That's so exciting to think though. And yeah, and I really love this talk because I mean, obviously, I do have my accounts of PTs from my friends who are PTs,
Yeah,
and also I work with them hand in hand in the hospital. We literally like work hand in hand to like help bring a patient up to walk,
definitely.
right,
Yeah.
in the hallway or whatnot. It's great to see like the whole light on the field, and it really shows the magnitude and the gravity of how important this field is because
Mhm.
literally the difference between a patient's hope, right? Like it gives patients hope, and
Mhm.
it's so amazing for a profession to like tangibly do that. And so it's such an honor to have
Oh,
spoken with you, and
oh my
I
gosh.
learned I learned so much, and I know you had to work earlier, so I didn't want to keep you for too long. But thank you so much for being with us. If there's anything else that you want to share to us or tell us as a closing, because I really didn't want to keep you for too long, because I know you had to work. I can imagine all the paperwork.
You're so sweet. No, I mean, really, like, I really love this. I'd be happy to come on again. Like, this is so fun. And thank you so much for having me. I love
Of
talking to
course,
you. It's so,
me
like,
too.
one day we need to meet, like,
No,
IRL.
no
Like,
longer like no
I
longer Chris.
know.
It's so funny how you were here and I was there like
Yeah,
at the same exact time frame.
that's
That
great.
is so funny. But I'm gonna visit Cali again soon, so
Okay, let me know.
where I'm gonna see you on the West Coast.
Yes.
I call her Ate, my Ate Veronica.
Yeah, ding.
Thank you so much. Please have a good rest of the night, and thank you everybody. Thank you.
You,
Bye. Good
bye.
night. Good
So
night.
fun.
Bye.